Hair loss treatments for men? In this video you will discover what hair loss treatments for men? What are the causes and the symptoms? And what are the best treatments? These tips will serve you all your life. So, please stay to the end of this video. It's worth it. Hair loss, the causes and misconception of male pattern baldness. Hair loss, the causes and misconception of male pattern baldness. There are roughly 80 million men and women in the world suffering from hair loss. In humans, it is caused by a number of different factors. Male pattern baldness is the most common form of hair loss and is estimated to affect 90% of men by age 50. That said, pattern baldness, or natural hair loss, isn't specific to men. Women suffer from female pattern baldness as well. Why people lose their hair? Male pattern baldness, clinically known as androgenetic alopecia, is the most common reason for hair loss. It's related to dihydrotestosterone (DHT), a naturally occurring hormone present in all men. DHT has a detrimental effect on the hair follicles. It slows down hair production and causes new hairs to be shorter and weaker than usual. The hormone can even completely stop hair growth, gradually depleting your stock of hair. There are a number of other reasons why people go bald, including other forms of alopecia, the treatment of terminal illnesses and diet, just to name a few. Surgical hair loss treatments like Bosley are most commonly used to regrow hair loss caused by male pattern baldness. Misconceptions about hair loss. By default, men typically blame mom for hair loss, as it was widely understood that hair loss is simply inherited from their mother's side. This is just one of a number of common hair loss misconceptions. Hair loss is inherited from your mother's father. Not true. Baldness is inherited but from both your mother's and father's genes. Hair loss slows and eventually stops as you age. Not true. Hair loss is a progressive trait that doesn't stop, in fact, it gets worse with age. Hats or helmets can cause hair loss. Not true. Wearing something on your head has no effect on hair loss. Although hairpieces and weaves that pull and strain your hair may cause traction alopecia. Brushing or massaging the scalp reduces hair loss. There isn't sufficient evidence to conclude that brushing or massaging the scalp prevents or reduces hair loss. Too much sun causes hair loss. Not true. Though excessive sun exposure is damaging to your hair, there isn't evidence to conclude that it causes permanent hair loss. Hair loss treatment. As previously stated, there are various hair loss treatments, which have been proven to stop hair loss, and in some cases even regrow lost hair. Of the non-surgical hair treatments, Propecia and minoxidil seem to be effective with a significant number of people. New, alternative methods of laser treatments have also been developed. First, there was the laser comb, which employs low-level laser light technology to coerce hair follicles to regenerate. The handheld device requires people to spend 20 minutes a day running the comb through their hair. Recently, technology has been further developed, evolving into a more effective, less intensive treatment. In the new laser treatment, a laser light helmet is used to aim at high concentrations of laser light at affected areas of the scalp. If you, however, have already experienced significant male pattern baldness and are looking to naturally and permanently cover your bald spot, then hair restoration surgery might be your best bet. Hair restoration. Over the past century, hair restoration has become one of the most popular cosmetic surgeries among men and women alike. There are a plethora of hair restoration surgeons in the United States, many of which provide their patients with stellar results. Hair restoration surgery involves transplanting hair follicles from the donor areas of the head, typically the back and sides, to the bald or thinning areas. These are called grafts. Each graft can contain between 1 to 4 hairs. Because the donor's hairs are from areas of the head that are not prone to balding, they are considered permanent when transplanted to balding areas, such as the scalp. The result is often a permanent, natural-looking head of hair. Hair loss treatments for men. With hair loss in men, the hair at the temples recedes and the crown can also begin to thin. Eventually, a horseshoe pattern around the sides of the head appears. The main signs of hair loss in men: 1. Receding hairline. 2. Moderate to extensive hair loss, particularly on the crown of the head. About 95% of hair loss in men is attributable to androgenetic alopecia, also known as male pattern baldness. Some believe this condition includes 3 factors: 1, age; 2, heredity; 3, the male hormone testosterone. As hair loss in men progresses, the hair becomes finer, does not grow so long, and the bald spot at the crown widens. Finally, the thinning crown and the receding points may meet, forming a horseshoe pattern with hair around the sides of the head. Hair loss in men can begin as early as 20, although, for the majority of men, hair loss is more noticeable from the age of 35 to 40. DHT, dihydrotestosterone, is recognized as the main culprit. DHT is a combination of testosterone and androgen receptors mixed with sebum and dirt particles. Some hair follicles are particularly sensitive to DHT and tend to shrink when exposed to it. Finally, the hair follicle may shut down altogether and the hair falls out. Another condition is called alopecia areata, in which hair comes out by the roots in 1 or more spots. It is much less common than androgenetic alopecia. Other causes of hair loss in men can include scalp infections, nutritional deficiency, systemic illness, and severe stress. Propecia for male pattern hair loss. There are many medications that can deal with male hair loss. A well-known medication is known as Propecia. This particular medication is designed to specifically help men who are experiencing male pattern hair loss. In clinical studies, hair count increased during the first year and was maintained in those that took Propecia for 24 months. If you wish to take Propecia, it is useful to know how this medication can possibly help you in your hair loss. Propecia, in generic terms, is known as finasteride. It is known to help men that are dealing with male pattern hair loss, also known as DHT. This particular pattern of baldness and hair loss is known to directly affect men because of genetics that are inherited from both their mother and father. The genes cause the hormone of DHT to react with the enzymes that are located in the scalp and hair region. When this happens, hair begins to thin and eventually causes it to fall out completely. Propecia is a prescription medication that has proven to be more effective in men than in women. Propecia will interact with male pattern baldness by adding an androgen hormone as a possible treatment. This will then balance out with the enzymes and other chemicals that are causing hair loss. Women must not use Propecia when they are pregnant or hoping to get pregnant. Propecia can potentially cause abnormalities of the male baby's sex organs, a condition known as hypospadias. Additionally, women should not handle crushed or broken tablets when they are pregnant or may potentially be pregnant. Propecia is FDA approved. Despite this, there are side effects to taking Propecia. Because of the added hormone, a small percentage of men have reported less desire for sex and difficulty in achieving an erection and/or a decrease in the amount of semen. There may also be possible allergic reactions that occur, which can be noted from rashes, itching, or irritation that takes place. If you should observe any of these symptoms, it is best to stop taking the medication and ask your doctor before you continue with the prescription. Propecia is one of several medications that are available for those dealing with male pattern hair loss. Speak to your doctor to find out more about Propecia if you are interested to use this medication to help you in your treatment of falling hair. Knowing what your options are and evaluating your risks will ensure that you make the best choice possible for treating your male pattern hair loss. Thanks for watching. If you liked this video, please hit the subscribe button to receive more like it in the future. If you liked this video, share the love and give it a thumbs up.